Hi everyone, thanks for coming to our session. We're really excited to be with you today and to talk about what we've been doing over now a 4-year relationship and counting with WorkSafe. We haven't actually talked about this before at PIEF, so we'll try to catch everyone up on what's been happening and also what we've been learning together in our partnership. As discussed, my name's Hugo. I'm one of the co-founders of Perx. I look after our Australian business and our product. Then we have a US business as well. I'm joined by Simon, who's been absolutely pivotal in the last few years of what we've been doing with WorkSafe. So very happy to have him on stage with us to talk about some of our successes together, and Fiona from my team as well. In terms of today, we'll go through a pretty classic structure, I would say, of what's the problem. Many of you won't even know what Perx is, so we'll talk about that for a little bit. Talk about how we got started with WorkSafe in a very quick pilot, which I think might be interesting as people think about how do you get started with different solutions, and then the broader trial that we did and the key insights from that. We will try to leave time for questions at the end, so please engage online or save them. I think there'll be a roaming mic as well. So in terms of the problem we're setting out to solve together as a partnership is that in the workers' comp context, people fail to adhere to their treatment plans. That's true for medical professionals like GPs and what they're prescribing. It's true for allied health as well. People only do about half of what they're told to do. And so we could literally make healthcare twice as effective if we got people to do everything that they're told to do by their care team. There's a huge amount of variance across providers. Some providers have the time, have the motivation to actually be able to help people with that implementation, but it's not standard, and it really depends on the luck of the individual as to how self-motivated they are and how motivated their provider is as well. But we also know that individual engagement in health and recovery is absolutely critical to getting the outcomes that we all want to see, that return to work, but let's also be honest, a return to health for that individual. And that's the impact that we get to do every day in this industry, and we're very proud of the work we do together to get those outcomes. And then the final problem is that when you think about the lived experience of that individual, I think it's easy to forget that 95% of the time they're on their own. They might have a touch point with a case manager once a week, see a medical professional once a week, but the vast majority of that time the individual is having to manage on their own, manage quite complex treatment plans across a range of different modalities, possibly a range of different workers' comp related, but also pre-existing conditions. And so it really comes down to that self-motivation between those interactions with their care team. So that was some of the problems we set out to see if together we could build something on the Perx platform that would make a difference for people. So what is Perx ended up looking like in injury management? It's a self-management tool for an individual to stay engaged and motivated as they manage their recovery treatment plan. As mentioned in the bio, I'm a big believer that we can really empower people through digital tooling, not just to engage with their providers, but actually just to manage themselves and get that better outcome. When people come into our app, they see simple tasks to complete every day, and then they see motivation to actually get that task list done. And I think that's absolutely critical. It's all well and good telling someone what to do and making that easy for them, but if they don't carry through, then we're not having impact together. And so what my product team thinks about literally every day of their lives is how do we make this a more and more engaging and motivating experience for people? We're big believers that when it comes to behaviour change, when it comes to habit formation, and indeed the evidence shows this out, is that positive reinforcement is the way to change behaviour. And so we think about how do we give that person a little moment of instant satisfaction every time they do something positive for their health. Unfortunately, doing a rehab exercise, taking a medication, getting to a psych appointment might not feel that great in the moment. So how can we use digital tooling through Perx to boost that? For some people, it'll be more financial incentives, so earning gift cards through our app, or if they're more altruistic, donations to their favourite charity. For some people, it's more an intrinsic motor. Getting on a 100-day streak becomes really motivating for them, or reaching a new level. And then for some people are more socially wired. They're thinking about competing with others, or maybe they want to collaborate with others in the social forums in our community. There is no one-size-fits-all for motivation. There's no one-size-fits-all for the personality of all the wonderful humans that we get to work with. But our product thinks about how do we get them to come back day by day, month by month, to manage that complex treatment plan and get the best result possible. I can talk about our product literally for hours, and that's not my job today. So the very simple version is that Perx becomes that all-in-one tool for managing your recovery, whether that's physical therapy exercises prescribed from Allied Health, whether that's medication, whether that's appointments, whether that's submitting a medical certificate, whether that's doing exercise, whether that's reporting a prom. All these different things happen in the Perx app. So it becomes that one-stop shop, makes it really easy for the individual. 2 is we obviously remind them of what they have to do, when they have to do it, and we try to make that motivating, because number 3 is the strategies that make it motivating. So earning gift cards, getting up leaderboards, collaborating with peers. These are the kinds of things that actually drive people to stay engaged. And the best thing is we have algorithms that work in the background trying to figure out this person's enjoying the rewards, this person's thinking about the leaderboard a lot, and tailoring their experience to really maximize the impact we have with every individual we work with at scale. So, having kind of headed down this road, we definitely weren't, as well versed in injury management as we are now, having worked with WorkSafe for so many years. But we set out together in a partnership to pilot that proposition. And I think in hindsight, and it's only in hindsight that I realised this, that the thing we did best as partners, at least in those early days, was really scope down that first pilot. And I can tell you as a founder, scoping down a pilot is not what you want to hear. You want to hear big. But what we got to see was that working with a small cohort, doing just a few months, what could we prove? And so the focus here was on experience. It wasn't on outcomes, which people in this room might be like, oh, but surely you want to show outcomes. Don't worry, that comes. But focusing on the experience first, because if we can't get people to enroll, stay engaged in the program, really love the experience, then really Perx doesn't have a reason to exist. And so we worked with people on both physical injuries and mental injuries. We worked on a small program, like literally just dozens of people in the first few months. And we sought the kind of quantitative and qualitative feedback about how they were doing on that experience. We saw really high uptake. So just through sending people emails with nothing more, people were signing up proactively because it's a product that they actually get excited about using. People were engaging with it 4 or 5 times a day on average, which is what we want to do, which is really walk with that person as they manage their health. And then we saw, both in qualitative and quantitative feedback, that the vast majority of people were having a really positive experience. And we saw these insights about people talking about Perx helping their cognitive burden, that there's a huge burden that comes with managing workers' comp, that managing not only the injury, but everything else that goes around it. And we heard in a series of testimonials that the WorkSafe team captured at that time, that people really felt that benefit for them. And for my product team, it was ultimately the validation that the one-stop shop really had a purpose in workers' comp to bring together all those complexities that exist within a fragmented healthcare system and stitch that together at least digitally so that the person has the one kind of to-do list that they can go back to and know that if they're adhering to that, then they're on the good path. That culminates in stories like Peter's, who was a 45-year-old male who was managing both a mental health condition and a physical injury. His main things was using Perx for medication. Other people use us, as I've said, for physical rehab or exercise or a variety of different tasks. And he was also managing quite a complex care team of appointments, which you can imagine, Allied Health, psych, GPs, all around him, surgeons as well. In just a few months on Perx, he completed 617 tasks. That's a lot, and that shows you the burden of actually managing yourself in this context. He hit 98% adherence. It's not perfect, but we think it's pretty good for him, and he hit over a 4-month streak of perfect adherence. It's not surprising he had a pretty good outcome on his claim, but the thing that he spoke about at this point was that Perx was a game changer. And this really resonated, I think, with the exec team at WorkSafe, that this was really changing the game for these individuals, that we were people who might have struggled with staying on top of their health were now on top of it, and that it became an app that he could truly recommend to everyone who had to manage their health multiple times a day. So that was the first kind of 6 months of our work together, really just to show fast, quick, can we have a benefit on experience? Having succeeded in that, then of course the logical question came, which is, okay, great for the experience. What does this mean for outcomes? But I'll hand over to Fiona, who's been leading that work from our side. Thank you.
Thanks, Hugo. So we were really excited about those early indications in the pilot, and obviously that qualitative feedback was really important. But what does that mean from a longevity perspective? How do we look at this pilot and look to scale? And I think we were really fortunate with having this amazing collaboration with WorkSafe, and 100% credit to Simon and his team around thinking, how do we look at these outcomes and ensure that we're building ourselves to properly evaluate at the end? So looking at trial for outcomes, looking at that recovery and return to work rates in a really logical way. So we built out this trial, and it was a 2-year trial. So we looked at multi-year, and we had to look at thousands of claims. Really importantly, we were looking at a randomised control trial. So we had control that were not getting access to Perx, and it was a prospective design. So we were really unique, and we feel very robust in terms of proving out the value of what Perx was doing in this cohort. We made sure we collaborated with understanding what does WorkSafe evaluate, so what's important to them. So at the end of the trial, they had a very clear understanding, in line with potentially other pilots they were running, what was Perx doing in this cohort of users. So the cohort, similar to how we had that early intervention with the pilot, was across physical and mental injuries. From an evaluation perspective, we looked at the control group, so it was a randomised control group, and you'll see some of those numbers, and then an outcome, we're looking at the recovery, and really importantly, that return to work rate at that 26-week and the 52-week, which is reflective of what WorkSafe Victoria are also looking at. So sample size was really important. Obviously, we want to have statistical significance, so having a decent sample size is critical. You can see here we had a large portion in the control group, and then also a large portion referred to Perx and actually downloading the Perx platform. And this was over 24 months. So we started in 22, we finished up the end of last year, and we've since rolled out into all claims across Victoria, which Simon will talk to how we did that. But I think the vision at the very beginning was having the end in mind, and I think that's really critical. You need to know what you're looking to achieve at the very end, but start that process at the beginning. So early indications, we were looking at that 26-week mark. Really positively, we already had a return. So 1.3 times more likely those people in the Perx group were returning to work and having their claims closed. We also have other measures that we look at within our application, and Hugo talked to that around engagement, adherence across all our all activities relating to recovery. But importantly, we needed to look at the financial aspect. When are those claims closing, and how is that experience with those Perx users versus the control? So 26 weeks, we're already having a positive result. And then we go into 52 and we're having an even better result. So 1.7 times more likely to return to work or have that claim closed. So we're confident that that statistical significance has been achieved, and we know that the Perx is what is moving the needle in this cohort. So before I hand over to Simon, I think there's lots of different ways that I could talk about the outcomes and what we achieved within the pilot and more broadly the trial. But how do we get there? And I think that's really critical. We've seen an amazing collaboration with WorkSafe. We also have a very strong and robust collaboration with QBE, and we also interpret and understand what that ROI is based on the raw data that they provide to us. Simon's going to talk to you a little bit about the financial returns and how he's kind of scaled that out and took that across all of Victoria, but also what are some of those implementation learnings, which I think is hopefully what you'll all benefit from, and knowing that rolling out a pilot with the end in mind is lots of internal discussions, but having a true partnership, and I think that's credit to WorkSafe Victoria around how we did it, and hopefully you'll all benefit from what Simon's got to say.
Good afternoon, everyone, and great to be here, and great to be here in partnership with Perx as well, and sharing. Really, as Hugo touched on, it really was quite a long journey, but a very fruitful one. So really, I think the first thing was really the financials. So I know Fiona's just taken you through the return to work outcomes at 26 and 52 weeks. And I think what we'll talk about, and you'll see in a few of the further testimonials as well, is there's really two parts to this that we were very mindful of. We wanted to be able to see probably the return on investment and the financial outcomes, but we also wanted to understand the experience of our end users and our injured workers. So that was really important. And so I think, as we touched on there, 1.7 return to work, better than those workers that didn't engage with the app. 3 million in projected savings, which was quite significant, and also that eight-time return on investment, which I think, again, makes it easier to sell when we're sort of talking about what are the outcomes and where to from here. So I'll just move on, I suppose, to the next one. And this is really this I suppose, worker experience. So this is just Susan, 63-year-old, but really for her, the use of the app was really around making that recovery journey just that little bit easier. So, again, 8 tasks a day, quite an active user within the app, and really found it helped her in her recovery, which I think is really important. So I think with any of this, and I think a few people in the room, as Fiona said, would probably be sitting there going, would this work for us? Would this work in our jurisdiction? Would this work in our scheme? And I think, I think what we sort of found, and I think it's really clear, and I know Fiona touched on that as well, is being really clear around what evaluation, what success looks like. So I think it's really important to make sure that they are very clear up front. And then if you then are able to do that, bring people on the journey with you, then it makes it a lot easier at the end when you're really sort of saying, okay, we really want to invest and roll this out as a BAU product. I think the other one is being very flexible and adaptable. So this was a long journey. There was a lot of needs to make some slight changes along the way, adapt, make sure. I think we had some challenges around, workers not knowing who Perx were when they were actually reaching out. So again, just making sure that communication is really clear. And I think the other one is always very important that we found was, whilst we're in the pilot and whilst we're working through what we're seeing and adapting and moving as we go, really having that in mind on what does operationalising it look like. Because I think, there's the tech, there's the effort, and of course there's the best way to do it moving forward. So that was really a clear one. Again, engagement and communication was really clear. So, this was a lot of work going on between WorkSafe and Perx directly. But again, we needed to engage our agents and make sure our agents knew what Perx was and how that can actually support a worker in their recovery. I think the other one was really planning for what are the questions that are going to come up when you are looking at completing a pilot and actually looking at rolling it into BAU. So just be very mindful of who those decision makers are. What questions will they have in relation to the return on investment, the worker experience, and how well this can be operationalised and at low impact. So where are we now? So we rolled this out as BAU in March of this year across every worker has access to it very early on in the claim to assist that early recovery. So that's rolled out. We are also supporting our agents, as I said, in relation to how this is something that can be incorporated into a broader recovery plan for an injured worker. The other is we are working with Perx at the moment around white labelling. So again, making sure that it's very visible, that it's a WorkSafe led app together with Perx to make sure that workers can resonate with that and actually fit for purpose. The last one we will want to share with everyone is really that sort of injured worker experience. And I think there's some videos here of some workers that really have seen the benefit and really have been impacted by this support. Hopefully they'll play.
It's been good to track to see how well I have been recovering, because some days you don't feel like it, and it actually is a good benefit to look back and see that you are actually on the right track and moving forward. So with Perx Health, without it, I probably wouldn't be as far ahead with my recovery as I am.
Perx has really helped me with my journey on my mental health injury. The Perx app is really good at reminding me to take my medication on time, the right time, helping me to get outside and go for a walk. It's really good for reminders such as, anything you want to put in there, really. If you want to have a reminder to call a friend or to refill a script or whatever, you can put that into the app, and you get rewarded for completing these little tasks that can help you in your recovery.
But on top of that, you'll be able to schedule your recovery and keep track on how you're progressing. And I guess this app is very, very powerful in that sense. And without it, I think I'd be pretty lost.
It's definitely been very motivational for me, and I definitely recommend it. The biggest thing that I think Perx has given me is it's definitely helped decrease my stress load. So thank you, Perx. I appreciate it a lot.
That's how Perx works.
So thank you, everyone, and thank you for Fiona and Hugo for co-presenting today, and happy to take any questions. I think we've got some time, Adrian.
Thank you, guys. So we do have a couple online questions, but if we have anyone in the room who wanted to launch a question, please pop your hand up, and we have Hannah with a microphone. But keeping in the theme of app-driven communication, we've got questions online. You'll love it, Hugo. So the first one's from Ben. So who or how are tasks added to an individual's profile or on their app? Is that maybe yourself, Hugo?
Yeah, I mean, it's a variety of different ways. I think is the first thing to reinforce. Often people, that person does ultimately have to feel empowered to manage their health. And so I should step to the mic for online. So number one is the person themselves. They need to be empowered. They need to own that treatment plan. And if we think about without Perx, they're very much on their own. So we've got to get that person kind of not only knowing what to do, but also the real nuts and bolts of, like, are you doing it that at 8 a.m. or 2 p.m.? Like, that's a very personal choice that no one else can tell that individual to without that individual being involved. We do know some providers get involved either directly with the person in the app. We also have a care portal that individuals can share with their provider. But also we did a lot of work over multiple series now with the WorkSafe team in thinking through probably less the medical journey, but more the claims management journey for that individual and scheduling out all the tasks that need to be done there, all the information that's going to be helpful for that individual. It's a really great way to get little snippets of information in front of that person. It's another task to be done, if I'm honest. Get that information in front of that person. So it is a compound of the individual themselves, providers getting involved where they have capacity, and then also, in our case, our customers, but WorkSafe specifically, thinking about, okay, well, if we have these people's attention for 4 times a day, what can we be, working on together? What do we know they have to get through on top of all that? So it's and what our systems do is combine all that and ultimately make it in one place so that they're not trying to figure this out across emails, doctors' written notes, treating physios, but actually get it all together. So hopefully that's an answer.
Beautiful. No, thanks, Hugo. So plenty of channels and everyone's contributing. Do we, and this might be one, Simon? Oh, crumbs, it moved. Do we go through the claims agent or WorkSafe to implement on claims, and is there a cost in the claim to use this? It's from Michelle.
Yeah, I can answer that one. So probably through the pilot and as part of BAU, WorkSafe is sending the data out to Perx directly, so not via the agent, and then it's an opt-in for a worker as to whether they want to use the app. And then if the worker does actually opt in, then of course that's then communicated to the agent, so they know as part of the broader conversation around recovery, around all other services, treatment, occupational rehab support, any other sort of claims activity, it can all be incorporated into that one sort of plan and one strategy of supporting that worker return to work. And so from a cost perspective, so it is a monthly cost that actually for the use of the app, and that through the pilot was paid for via WorkSafe as part of the pilot, but now it's part of a claims cost. So it's just paid as part of a normal account that would be paid for administrative cost on a claim. So, and it is claims.
Thanks, Simon. Is there anyone in the room with a question? Oh, sorry, over this side. Sorry, thank you, Hannah.
Hi, I was just wondering, is this also open to self-insurers in the VIC scheme?
Self-insurers? No, it's not.
And second question, sorry. So as the agent, if you've potentially got team members or workers using that service, do you know?
Yes, you do. Yep. So they're advised that the worker has opted in to use the app, and then the actual invoice that comes on a monthly basis is kind of billed directly to the agent.
Thank you.
We might do one more online question, which links into that one around, I guess, initiatives or actions that an agent might take for users that are, I guess, registered but not actively using the app. Is that something that is strategised around from a case management perspective?
If a worker has basically opted into the app and is using the app, then their adherence is really up to the worker. The worker's the one motivated and using that. So again, what we encourage the agents to do is sort of have that conversation with the injured worker, understand how they're using it, how it's being used for them, how they're finding it. So again, really just sort of build that into that just ongoing conversation.
I think one thing I'd add to that is we believe in performance-based pricing at Perx, and we think this is a step closer to value-based care, which is where if people don't use our app, we don't charge. So there's not like it's not like an upfront annual subscription or something where people could drop off, but ultimately we're held to account. So we only earn revenue when people use our product. We only earn revenue when they keep using our product and get the benefits over time. And I think that's really critical for like our partnerships. It's aligning that incentive as much as possible so that, and I've talked about my product team a bit, and they're really critical to what the impact we have at Perx, but they're always thinking about, okay, well, how do we actually support people over the long term, not just be a blip in the, a flash in the plan and then disappear, but actually help people, and we have people on our platform in other contexts, not so much in workers' comp, who've been on our platform for literally years, managing chronic diseases, but the only way we achieve that is by aligning and being held to account on performance. So it's a big part of our model.
Excellent. Well, thank you, guys. It is kicking into lunchtime. So, sorry.
I was just going to say, you working with WorkSafe, are you doing things with other states, with the authorities?
Yes, we would definitely love to. We've had a long-standing relationship with QBE, and that works across workers' comp and CTP across Australia. In terms of other authorities, that relationship and the pilot and the outcomes that we've proven with WorkSafe Vic, we would definitely love to bring that into other states, but not at the moment. But yeah, definitely open to conversations, and if anyone's interested, we're obviously around over lunchtime, so please come and talk to us and the ins and outs. So.
We'll leave it there. Thank you very much. Please join me in thanking Fiona and Hugo from Perx and Simon from WorkSafe. Just a very quick point before we leave. This app, I believe, was recently voted one of the world's best health apps.
We've got a few awards.
We got a few awards, but it's recognised as a global quality app. So really appreciate you guys taking us through this. There is a Perx hub in the expo, so please swing by. Lots of questions online, and I'll pass those on to Hugo and Fiona to have a look. But enjoy your lunch and the afternoon.